you support caps on non-economic damages?
No, we would not support that. We would support some changes that deal with malpractice, but not artificial
Pollitt, let me
caps.
tell you the way this works. I ask the questions and then you answer them. Okay?
I want to give you a full answer.
Well, I'm going to ask you a series of questions, and I want crisp answers, not filibusters, crisp answers. Do you support limits on non-economic damages? That is not a complicated question. It's not a multi-part question. Do you or do you not?
Do not.
Do you support limits on joint and several liability?
Do not.
Do you support a different standard of care for emergency medicine as opposed to medicine where a physician has a robust chart or file in front of them?
I'm not sure I follow the question.
Emergency medicine, where a physician is called upon in a matter of seconds to make a decision, they don't have the benefit of patient history or a lot of tests. Do you support a different standard of care for those physicians as opposed to ones who do have a full history in front of them?
No, not.
So you would hold physicians who have a matter of seconds to make a decision to exactly the same standard that you hold physicians who have treated patients for 20 years?
Most physicians have access to clinical guidelines as to what works. And I would expect that any physician, emergency physician or otherwise, would look at those guidelines, not necessarily feel bound by those guidelines, but would use those guidelines in order to make a thoughtful decision for his or her patient.
So the answer is no.
I gave you a full answer to that question.
Right. Well, the answer was no. Do you support loser pays?
I'm sure I follow that.
Loser pays. You file a lawsuit, the jury finds it frivolous with a special verdict form. Do you support a reversal?
I think anyone who files a frivolous claim should pay physician costs.
So you support loser pays?
Anyone who files a frivolous claim should pay physician costs.
Do you know where the majority of the litigation comes from in this country, whether it's paying patients or non-paying patients?
It comes from paying patients.
No, sir. It comes from non-paying patients. The majority of the litigation, the lawsuits filed, come from non-paying patients.
I don't believe that.
Well, I can't help what you believe. I can just help what the facts are.